Hi, my name is Martha Murphy. I am in human communications. The CR number is 66275. My professor is Professor Meredith Reyes. This is my mock interview presentation. I have my sister, and she is playing the lead sonographist at the clinic, and I have my oldest son, and he will be playing the HR department. And the job that I am applying for is a sonographist. Thank you.
Good morning, Martha. Thank you for coming in today. How are you doing?
Good morning. I'm doing really well. Thank you. I'm excited to be here and have the opportunity to interview with you.
We're glad you could join us. To start, could you tell us a little bit about yourself and what inspired you to pursue diagnostic medical sonography?
Absolutely. I recently graduated with my associates of applied science in diagnostic medical sonography, and I completed my clinical rotations both in hospital settings and an outpatient imaging center. During those experiences, I discovered how much I really enjoy patient care and mixing that with medical technology. I wanted a career where I could make patients feel comfortable while also helping physicians diagnose medical conditions with them.
Tell us about your clinical experience. What type of examinations did you?
During my clinical rotations, I assisted with and performed abdominal, gynecological, vesicular ultrasounds, and that was all under the supervision of a registered sonographist. I became comfortable preparing patients for them. I positioned them and learned how the best forms of positioning them. I learned operating ultrasound equipment, and I learned capturing diagnostic quality images. And I also learned how to best perform having the layout for physicians to be able to read what I captured.
Since you're a recent graduate, what would you say is your greatest strengths, or one of your greatest strengths?
I'd like to think my biggest strength is my willingness to learn and adapt to the environment that I'm put in. I also seek real world experiences and guidance through others who've been in the field much longer. I seek the feedback of them because I believe that it has such substance because they have that experience. I'm very organized, I'm dependable, I'm committed to providing compassion, care for patients, and I'm very empathetic, and I think that the way to position our patients. I also got a lot of techniques from the people I shadowed on how to prevent injury and reduce the strain.
How do you handle constructive criticism?
So I view constructive criticism as an opportunity to grow and get better at my field of study, which is sonography. I think that when you take constructive criticism and you evaluate what the person is trying to help you accomplish, you can turn it and really grow from it and add it to your experience and learn how to do things better, more efficiently as well.
Accuracy is critical in sonography. How do you ensure your images are of high quality?
Follow established scanning protocols. I verify patient information before beginning the examination. I make sure to change the settings on the machinery during every new patient coming in, and I review every image I take very carefully before ending the study. If I'm uncertain about the quality of the images I've produced, I will seek the guidance of a senior sonographer in the building if possible. And that's just really to ensure that the physicians get the best possible images to diagnose.
Can you describe a challenging situation you encountered during your clinical rotations and how you handled it?
One of my clinicals, I had a very nervous patient. They came in for an ultrasound and they previously had a lot of health scares. I introduced myself to her and I walked her through the steps that we would be performing, as well as answered any questions she had. And the duration of the scan and the ultrasound, she became way more relaxed, and I really think that showed me how important empathy is with our patient care.
Our department often works with patients experiencing pain and emotional distress. How would you approach these situations?
Having an emotionally distressed patient, I think that remaining calm, professional, and compassionate is very important. Listening to their concerns and explaining procedures thoroughly and clearly, I've learned, is often a way to help them. Respecting their comfort levels and the privacy that they want and deserve is significant difference for them and their experience. I think also communicating any concerns they may have to my supervisors when needed is also important to know.
Why do you want to work at our facility?
I've heard great things about y'all's commitment to patient-centered care and professional development. As someone who is a recent graduate and starting their career, I'm really looking for a workplace that I can continue to learn from experienced individuals in, and I want to positively contribute to this team that you guys have and providing excellent care to patients as well.
Where do you see yourself in 5 years?
Do you have any questions for us?
Yes, thank you. What does your orientation and training process look like for newly hired graduates?
That's a great question. We have a structured orientation program that assigns mentors to new graduates.
That sounds really great. I really appreciate this and I can't wait to learn more about your team.
Thank you, Martha. We appreciate your time today. We'll be in touch after we've completed the interview process.
Thank you both for your time and your consideration. I enjoyed speaking with you today and I hope to have the opportunity to join your team. Have a great day.